One of the largest reasons I'm a chiropractor today is because of all the brain injuries and concussions that I personally dealt with playing high school sports and having three older brothers in roughhousing. Back when I was in high school, I had like a series of concussions that caused very consistent daily headaches that I managed primarily with ibuprofen. And it just kept getting worse and worse as the months and time went on, but I was able to keep playing sports and I enjoyed that. So whatever, I kept going. But then I had this one really severe concussion that didn't just increase and make the headaches worse, but it actually created this nerve damage in my neck that made it so I couldn't really lift my arms over my head anymore. I couldn't lift weights. I couldn't tackle people in sports. So that really scared me. And by the way, I was also at that time taking about 20 ibuprofen per day. So I started having these digestive problems because of all the abusing of this medication that nobody's supposed to be taking that regularly at that quantity for so long. So I tried physical therapy. I tried injections in my shoulders because that's where I thought that the issue was. I couldn't lift my arms over my head, so it's the shoulders, right? And eventually, I just kept getting worse and worse. So I told my football coach that I had to quit playing. And he suggested I try a chiropractor at that time. So my dad, who works road construction, used to go to a chiropractor, or still does actually. And I went with him the following night to his chiropractor. And he took some x-rays of my spine. He did an exam. He felt my neck. And he's like, I know what's causing these issues. And he set my C1 vertebra, my atlas vertebra, top bone of the neck. Looking at it on the spinal model, it's the very top bone that literally holds your skull on top of your spine. He set that thing, and I heard a big crunch. My headaches were gone instantly. And then he moved a little bit lower in my neck, and he set the C5 vertebra right in here. And the nerves that come out of C5, they power your hands, part of your biceps, part of your arms. So like things like carpal tunnel syndrome, and a lot of what I was dealing with was coming from that. And I felt lightning shoot down my hands, like my power was like back on. So that is why I'm so passionate about helping people with concussions, is because getting chiropractic care to manage mine changed and saved my life in so many ways. Definitely. Yeah, the gut brain connection is a very real one. I mean, a lot of professionals refer to your gut as your second brain. I mean, your microbiome, all that gut flora, that good bacteria that's supposed to keep us healthy, it weighs 3 to 5 pounds, just like your brain does. And so chronically abusing the ibuprofen like I was doing destroyed my gut health. I mean, I was having blood in my stools. I was having stomach pain. Um, so working on gut health is something that's very, very important for anybody, everybody really, but anybody who's had a concussion, they need to be doing a few things. So first and foremost, you've got to get the inflammation in your body down. That may start in your gut, that may be in your brain, that may be in your joints, but you got to get the inflammation down. So a lot of people need to be taking supplements. Some of the good ones that you could take is like magnesium and zinc and B vitamins and antioxidant related supplements. But you also have to avoid a bunch of stuff. You want to avoid inflammatory things. You want to avoid sugar. It's bad for your gut, bad for your brain, bad for your body. You want to avoid alcohol. It may be fun to do sometimes on the weekends, but if you've had a concussion, it's going to make your body more inflamed. It's going to destroy your microbiome, and you're not going to get better as quickly. You want to avoid seed oils. A lot of people don't really know what seed oils are, but those are some of those like oils and things that are hidden in our processed foods. A lot of the things that they fry things in, those inflame your body. And the half-life on a seed oil is like a couple of years. It takes like a couple of years after cutting those out of your life just to be fully rid of them. It's insane. Those things inflame your body. Those will make concussion recovery worse. And another thing that I think is very important, obviously I'm a chiropractor and I'm a chiropractor today because of my concussions, is you've got to get your spine checked. You've got to work on the alignment of your body. You got to make sure your neurology is functioning properly. And a lot of people don't realize that the curvature of your neck is what the blood supply to your brain passes through. So a lot of the time you have a concussion, you jam up the nerves in your neck, it kinks the curve in the wrong direction. Now your blood supply is not going where it should. So you got to maximize the blood supply to your brain. That requires more than just chiropractic, but that's probably for another conversation. Absolutely. So yeah, prevention is huge. You gotta you gotta be proactive about all things when it comes to your health. But especially if you're in a line of work or sports where you're more likely to have a concussion, you got to be proactive in a few ways. I mean, like I just mentioned, you've got to keep your inflammation down most of the time. You got to keep your body in a high recovery state most of the time. And you can do things like you can work on strengthening your neck just to make sure that if you get hit in the head or if you have some sort of a neck issue, it's going to bounce back and recover from it quickly. You'll have a better blood supply to your brain. You'll have stronger discs. Your ligaments will be more pliable. Quick story. My daughter actually a couple of years ago had an injury where she got a tooth knocked out. I think she was 5 years old or something at that time. And of course, we had to put the fire out. She had a tooth dangling out of her mouth, bleeding, traumatic situation. We got that taken care of. But then the first thing I did as a chiropractor is I checked her neck, and it was way out of whack. So I remember I had to adjust her, I think daily for a couple of maybe 2 or 3 days before it actually started to hold. My wife goes to our dentist, who's holistic minded just like I am. He's like, oh my gosh, I didn't even realize that when a person gets hit in the mouth, it probably affects their neck. Obviously, it's going to affect their head too. So we got to work on that. So from a preventive basis, I would say keeping your body in a healthy state to where you recover well and your inflammation is low, and working on strengthening your neck. And then obviously, in things, sports like soccer, college level women's soccer has more concussions than any other sport. So try to not hit the ball with your head and just do some of the obvious things to minimize the likelihood of having a concussion. And then from a treatment basis, if you do suffer from a concussion, there's a few different things that you should do. Medically managing it is very important, first and foremost. I am not saying don't go to the hospital. Getting an MRI, figuring out where you're at is very important. But then on a holistic basis, chiropractic. In our office, we don't just lay you down and start cracking things. We get to know you. We find out your history. We find out your goals. We take digital motion study x-rays to find out specifically where it is that you may be out of alignment and where it is we need to work on correcting. And then we get to work. We also do work heavily in our office on restoring the curvature of your neck and fixing ideal posture as much as possible. You got to work with what the body's got, but a lot of chiropractors don't do that. That is something that we do at Total Health Chiropractic.